Tim Sink now has a question on health care for Ms. Custer.
The Affordable Care Act, or HCA, is the law of the land today. Ms. Custer, I think that you've indicated that you are in support of it, and I believe Mr. Bass has indicated that he is in opposition to it. Setting those opinions aside and focusing on the details of health care, could you name 3 specific ideas that would improve or maintain access and reduce costs for health care, and how do these ideas work?
Absolutely, and I think you'll have to talk to Congressman Bass about whether he's for it or against it. In the first debate, he said he would repeal the entire thing. I'd be shocked if he truly wants to take away the prohibition on denying coverage for pre-existing conditions, the prohibition for denying coverage when a family member finally gets sick after paying premiums for all these years, and coverage up to age 26. In the second debate, the very next day, Congressman Bass took credit for those plans and said, oh, he was absolutely in support of that. These are policies that I strongly support to provide access to health care. Look, every single small business in this room knows the number one issue over the last 10 years has been the double-digit skyrocketing inflationary increases in health insurance coverage, and your concern about whether you can continue to provide health care coverage to your employees. I don't believe that Congress did the right thing on the cost issue. I think we should control costs to bring down costs. And this is where my Republican roots come in. I believe strongly in competition to increase competition to bring down the cost of health care. We need to provide alternatives. We need patient choice, both in the insurance market and in the health care provider market. But talk about having your head in the sand for Congressman Bass to dream of campaigning this session on repealing access for 31 million Americans to have access to health care. It will bankrupt small business all across this country.
Mr. Bass, you have 90 seconds.
Thank you. As a small business person myself, I learned very early on that the definition of competition is not one. And under the Obama health care plan, ultimately we will end up with a choice of one. Get beyond the rhetoric. Those of you who are in small business understand how serious this is. You know that the health insurance providers today are beginning to react to this health care bill by reducing, not increasing coverage. They know that the federal government is going to be setting the premiums and deciding what their profits are going to be or not be. There are alternatives. And I support the 3 provisions that were passed in the health care bill, but are sort of icing on the top of a sponge cake for what's to come in the future. I believe that that the health care bill should be repealed and replaced with universal deductibility, with meaningful tort law reform, with full funding for community health care centers, which are private nonprofit corporations that provide health care to low-income individuals that don't qualify for Medicaid, that health insurance policies ought to be available across state lines, that in general, health care insurance should not be from one, which is Washington, but rather from all across the country like all other health care, all other insurance instruments are sold. Homeowners insurance, automobile insurance, life insurance. But health care insurance today is based upon 2 criteria that have nothing to do with health care: where you live and who you work for. And I think we need to start at that root rather than moving toward government-funded, single-payer, socialized medicine in New Hampshire. Make no mistake about it, that's the direction that we are headed with Obamacare, which my opponent supports.
Tim has a follow-up for each.
Congressman Bass has a little bit of drama here with the single payer. Let me just say that I am opposed to single payer. It's not what the debate is about. The debate is about a public insurance option. It is simply an option, and it would be private insurance all across this country with an option for those who chose to go with a public option, much like the public university system. So I don't think anyone in this room would think that there's only one option for higher education. In fact, New Hampshire has many: the community technical colleges, the university system, and dozens of high-quality private colleges. That's what the system would look like. So the fixation with the single payer is something that I'm opposed to.
We'll stay on this for a minute. Tim, you have a follow-up for each?
I have follow-up for each. Mr. Bass, you had mentioned tort reform and buying across state lines. Could you articulate how do you see that saving substantial money?
My son broke his collarbone a year and a half ago skiing. He went to Spear Memorial in Plymouth. He took an x-ray. you could see that his collarbone was broken. It was read by 3 different hospitals at additional cost to me. I'm in a HSA with a $5,000 deductible. I doubt that any of those 3 hospitals read it. I don't know why they did that, but I suspect the reason was they were trying to spread the liability around if something went wrong. If we have meaningful tort law reform in this country, and when I mean meaningful, I mean setting reasonable limits that will provide for an assurable risk for medical malpractice, we're going to reduce the cost of health care by doing that.
Continue another follow.
I do. Ms. Custer, do you support reimportation of drugs and expanded use of generics?
I do, and I don't have a problem. I think competition with the access to prescription medication is, again, a way of bringing down costs. So I would actually encourage that in the federal government. I know it's something that's done now commonly in the federal, for example, in the VA and in other programs, and I think it's something that does bring down the cost. I think we've seen that. This was something that I was involved in here in New Hampshire with the Medication Bridge program to try to get access for affordable medication to seniors and families in need all across this state. And we worked with the hospitals and with the pharmaceutical companies to provide access to free prescription medication. And that program is now serving 16,000 families. So you can use these programs to bring down the cost of medication, and it is a very viable way to drop costs and make medication more available.